Aging is something every one of us experiences, but reaching the age of 60 doesn't automatically mean poor health. In fact, many people remain active, energetic, and independent well into their 70s, 80s, and beyond. The key difference is understanding how the body changes with age and recognizing the warning signs that should never be ignored. Welcome, everyone. I'm Dr. Megan Walker, and today we're talking about 20 diseases that commonly affect people after age 60 and the warning signs you should never ignore. This information is designed to help you become more aware of your health so you can seek medical advice early if something doesn't seem right. Remember, this video is for educational purposes only and is not a substitute for personalized medical care from your healthcare provider. As we grow older, our heart, brain, bones, muscles, eyes, kidneys, lungs, and immune system all undergo natural changes. These changes don't guarantee illness, but they can make certain conditions more likely. The encouraging news is that many of these diseases can be prevented, delayed, or managed successfully through healthy habits, regular medical checkups, and early treatment. Let's begin with one of the most common conditions, high blood pressure. Often called the silent killer, high blood pressure usually causes no symptoms until it has already damaged the heart, kidneys, or brain. Regular blood pressure checks are one of the simplest ways to protect your health. Heart disease is another leading cause of illness after age 60. Warning signs may include chest discomfort, shortness of breath, fatigue, pain spreading to the arm or jaw, or swelling in the legs. Never ignore these symptoms, especially if they appear suddenly. Stroke is a medical emergency. Learn to recognize the signs using the word fasty face, drooping arm weakness, speech difficulty, and time to call emergency services. Acting quickly can save brain tissue and improve recovery. Type 2 diabetes becomes increasingly common with age. Increased thirst, frequent urination, blurry vision, slow healing wounds, numbness in the feet, and unexplained fatigue may all be warning signs. Good nutrition, physical activity, and routine blood sugar testing can make a tremendous difference. High cholesterol usually produces no symptoms, but quietly increases the risk of heart attack and stroke. Regular blood tests help identify this hidden problem before complications develop. Osteoarthritis is the most common joint disease among older adults. Pain, stiffness, swelling, and difficulty moving the knees, hips, hands, or spine can make everyday activities challenging. Staying physically active and maintaining a healthy weight often helps reduce symptoms. Osteoporosis weakens bones and increases the risk of fractures, especially in the hips, wrists, and spine. Many people don't realize they have osteoporosis until a broken bone occurs. Bone density testing is an important screening tool, particularly for older women and individuals at higher risk. Muscle loss, known as sarcopenia, can gradually reduce strength, balance, and independence. If climbing stairs becomes difficult or getting up from a chair feels much harder than before, it may be time to discuss muscle health with your healthcare provider. Strength training and adequate protein intake are important ways to slow this process. The brain also changes with age. Mild forgetfulness can be normal, but persistent memory loss, confusion, getting lost in familiar places, or difficulty managing daily tasks may signal Alzheimer's disease or another form of dementia. Early evaluation can provide valuable support and treatment options. Parkinson's disease often begins subtly with a resting tremor, slowed movement, muscle stiffness, or balance problems. Early diagnosis allows treatment to improve quality of life. Depression is not a normal part of aging. Persistent sadness, loss of interest in favorite activities, sleep changes, poor appetite, or feelings of hopelessness deserve attention and treatment just as much as any physical illness. Vision problems become more common after age 60. Cataracts can cause cloudy or blurry vision, while glaucoma may silently damage the optic nerve without noticeable symptoms until vision loss has occurred. Age-related macular degeneration affects central vision and can make reading or recognizing faces difficult. Regular comprehensive eye examinations are essential for detecting these conditions early. Hearing loss often develops gradually, making conversations harder to follow, especially in noisy environments. Untreated hearing loss can contribute to social isolation and may even be associated with cognitive decline. Modern hearing aids can significantly improve communication and quality of life. Chronic kidney disease frequently develops without symptoms in its early stages. Swelling in the legs, changes in urination, fatigue, and high blood pressure may be clues that the kidneys need medical evaluation. Chronic obstructive pulmonary disease, or COPD, is especially common among current and former smokers. Persistent coughing, wheezing, excess mucus, and shortness of breath should never be ignored. Cancer risk also increases with age. Common cancers after 60 include breast, prostate, colorectal, lung, and skin cancer. Watch for unexplained weight loss, unusual bleeding, persistent pain, new lumps, chronic cough, or changes in bowel habits. Keeping up with recommended screening tests greatly improves the chances of finding cancer early when treatment is often most successful. Urinary incontinence affects many older adults, but is often left untreated because of embarrassment. Loss of bladder control is common, but not something you simply have to accept. Effective treatments are available. Shingles is another condition to be aware of. It causes a painful blistering rash that can lead to long-lasting nerve pain. Vaccination significantly reduces the risk. Pneumonia and other serious infections become more dangerous with age because the immune system naturally weakens. Staying current with recommended vaccinations, including influenza and pneumococcal vaccines where appropriate, can provide important protection. Finally, remember that falls are not a disease, but they are one of the leading causes of injury in older adults. Poor balance, weak muscles, poor vision, and certain medications can all increase fall risk. Regular exercise focusing on strength and balance, along with making the home safer, can help prevent serious injuries. Growing older is a privilege, and while age increases the risk of certain diseases, it does not determine your future. Paying attention to your body, recognizing warning signs early, maintaining a healthy lifestyle, and working closely with your healthcare provider can help you enjoy many active and fulfilling years ahead. Your health is one of your greatest investments, and every positive step you take today can make a meaningful difference tomorrow. Thank you for watching, and if you found this information helpful, don't forget to like, share, and subscribe for more evidence-based health tips from Dr. Megan Walker. Stay healthy, stay informed, and I'll see you in the next video. Cancer is one of the health conditions that many people fear most as they grow older, and for good reason. After the age of 60, the risk of developing many types of cancer increases significantly. This happens because our cells have been dividing and repairing themselves for decades. Over time, exposure to sunlight, pollution, tobacco smoke, unhealthy foods, infections, alcohol, and even the natural aging process can damage our DNA. Usually, the body's immune system identifies and destroys abnormal cells before they become dangerous. However, as we age, this protective system becomes less effective, allowing some abnormal cells to multiply uncontrollably and eventually form cancer. Although age increases the risk, it does not mean that cancer is inevitable. Many cancers can be prevented, detected early, and successfully treated when warning signs are recognized promptly. One of the most common cancers in older adults is colorectal cancer. This cancer develops in the large intestine or rectum and often begins as small growths called polyps. These polyps may not cause symptoms for years, which is why regular screening is so important. Early warning signs include blood in the stool, persistent constipation or diarrhea, changes in bowel habits, unexplained weight loss, abdominal pain, fatigue, or a feeling that the bowel never completely empties. Many people ignore these symptoms because they assume they are caused by hemorrhoids or simple digestive problems. However, any persistent change in bowel habits should be evaluated by a healthcare professional. Colonoscopy screening can detect and remove polyps before they become cancer, making it one of the most effective cancer prevention tools available. Prostate cancer is one of the most common cancers affecting older men. The prostate gland naturally enlarges with age. Not every urinary problem means cancer. However, symptoms such as difficulty starting urination, weak urine flow, frequent nighttime urination, blood in the urine, pain during urination, or discomfort in the lower back or hips should never be ignored. In its early stages, prostate cancer may produce no symptoms at all, making regular medical checkups and discussions about screening especially important. When detected early, prostate cancer often responds very well to treatment. For women, breast cancer remains one of the most common cancers after the age of 60. Early detection saves lives because breast cancer is often highly treatable when found before it spreads. Warning signs include a new lump in the breast or underarm, changes in breast size or shape, skin dimpling, redness, nipple discharge, or a nipple that suddenly turns inward. Not every breast lump is cancer, but every new lump should be evaluated promptly. Mammograms remain one of the best screening methods for detecting breast cancer before symptoms develop. Lung cancer is another major concern, particularly for people who smoke or have smoked in the past. Smoking remains the leading cause of lung cancer, but it can also occur in people who have never smoked. Persistent coughing lasting more than 3 weeks, coughing up blood, chest pain, unexplained weight loss, shortness of breath, repeated chest infections, or persistent hoarseness should all be taken seriously because early lung cancer often causes few symptoms. Individuals at high risk may benefit from low-dose CT screening based on their medical history and healthcare providers' recommendations. Skin cancer also becomes more common as years of sun exposure accumulate. Many people underestimate the dangers of excessive sunlight, especially if sunburns occurred repeatedly during childhood or early adulthood. Warning signs include a mole that changes in size, shape, or color, a sore that does not heal, a spot that bleeds easily, or a new skin growth that continues to enlarge. The ABCD rule is a useful way to remember suspicious moles: symmetry, irregular borders, uneven color, diameter larger than about 6 millimeters, and evolution or change over time. Protecting the skin with sunscreen, wearing protective clothing, and examining the skin regularly can help detect problems early. While cancer is a major concern, prevention involves much more than screening alone. Daily lifestyle choices have a powerful influence on long-term health. One of the most important steps is maintaining a nutritious diet. A diet rich in colorful vegetables, fruits, whole grains, legumes, lean proteins, fish, and healthy fats provides vitamins, minerals, fiber, and antioxidants that help protect cells from damage. Reducing processed meats, sugary beverages, highly processed foods, and excessive alcohol can further lower cancer risk. Regular physical activity is another powerful tool for healthy aging. Exercise strengthens the heart, maintains muscle mass, protects bones, improves circulation, regulates blood sugar, immune system. It also lowers the risk of several cancers, heart disease, diabetes, and depression. Even moderate activities such as walking, cycling, swimming, gardening, or light strength training performed most days of the week can provide remarkable health benefits. Maintaining a healthy weight is equally important. Excess body fat contributes to chronic inflammation and hormonal changes that increase the risk of several cancers, including breast, colorectal, pancreatic, and kidney cancers. Healthy eating combined with regular exercise helps reduce this risk while improving overall energy and mobility. Adequate sleep is another essential part of healthy aging that is often overlooked. During sleep, the body repairs damaged tissues, balances hormones, strengthens the immune system, and supports brain function. Chronic sleep deprivation has been linked to increased inflammation, obesity, diabetes, heart disease, and possibly a higher risk of certain cancers. Most older adults benefit from 7 to 8 hours of quality sleep each night. As we grow older, our bodies naturally go through many changes. These changes don't happen overnight, and they don't mean that illness is inevitable. However, after the age of 60, the body's ability to repair itself becomes less efficient. Cells regenerate more slowly, muscles gradually lose strength, bones become thinner, blood vessels become less flexible, and the immune system doesn't respond as quickly as it once did. These normal aging processes can increase the risk of developing chronic diseases, which is why understanding what happens inside your body is one of the most powerful ways to protect your health. The good news is that aging itself is not the enemy. Many people remain healthy and active well into their 80s and 90s because they recognize potential problems early and take steps to prevent them before they become serious. One of the first systems affected by aging is the cardiovascular system. Over time, the heart has to work harder because arteries gradually become stiffer. This makes it easier for blood pressure to rise, even in people who have never had hypertension before. High blood pressure often develops silently without causing noticeable symptoms, which is why it is commonly known as the silent killer. Left untreated, it can damage the heart, brain, kidneys, and eyes for years before a person realizes anything is wrong. Regular blood pressure monitoring becomes increasingly important after age 60 because early treatment can significantly reduce the risk of heart attack and stroke. The immune system also changes as we age. When we are younger, our immune cells quickly recognize and fight infections. After 60, this response becomes slower and less effective, making older adults more vulnerable to illnesses such as influenza, pneumonia, shingles, and other infections. Recovery also tends to take longer. A simple cold that lasts only a few days in a younger person may linger for weeks in an older adult. This is one reason why vaccinations, good nutrition, regular exercise, and adequate sleep become even more important later in life. Supporting the immune system helps the body defend itself against diseases that could otherwise become serious. Another important change occurs in the musculoskeletal system. Beginning around middle age, people naturally lose muscle mass every year, and this process accelerates after age 60. This condition, known as sarcopenia, can reduce strength, balance, and mobility. At the same time, bones gradually lose density, increasing the risk of osteoporosis and fractures. Even a minor fall can result in a broken hip or wrist, leading to lengthy recovery periods and reduced independence. Fortunately, strength training exercises, regular walking, balance exercises, and sufficient protein, calcium, and vitamin D intake can help slow these changes and keep the body stronger for longer. The brain also experiences age-related changes. While occasional forgetfulness can be a normal part of aging, persistent memory loss, confusion, or difficulty performing familiar tasks should never be ignored. Blood flow to the brain may decrease over time, and the risk of conditions such as Alzheimer's disease and other forms of dementia increases with age. Fortunately, keeping the brain active through reading, learning new skills, social interaction, puzzles, and regular physical activity may help support cognitive health. Managing blood pressure, diabetes, and cholesterol also protects the brain by maintaining healthy blood vessels. The body's metabolism slows with age as well. Many people notice they gain weight more easily despite eating the same amount of food they did years earlier. This happens because muscle burns more calories than fat, and losing muscle reduces the body's daily energy needs. A slower metabolism also increases the risk of developing type 2 diabetes, especially if physical activity decreases. Maintaining a healthy diet rich in vegetables, fruits, whole grains, lean protein, and healthy fats while limiting processed foods and sugary drinks becomes increasingly important after 60. Vision and hearing also tend to change over time. The lens of the eye gradually becomes less flexible and may become cloudy, leading to cataracts. Other age-related eye diseases such as glaucoma and macular degeneration may develop without obvious symptoms in the early stages. Hearing loss often develops gradually, making conversations more difficult and sometimes leading people to withdraw socially. Regular eye examinations and hearing evaluations can detect these problems early, allowing treatment before significant loss occurs. The kidneys and liver also become less efficient at filtering waste products and processing medications. This means older adults may be more sensitive to certain drugs or experience side effects more easily. It also highlights the importance of routine blood tests, staying well hydrated, and discussing all medications and supplements with a healthcare provider to ensure they remain safe and appropriate. Perhaps the most important reason disease risk increases after age 60 is that several small health issues often occur together. High blood pressure, elevated cholesterol, excess weight, reduced physical activity, and slightly elevated blood sugar may each seem minor on their own. However, when combined, they significantly increase the likelihood of heart disease, stroke, kidney disease, and other serious conditions. This is why preventive healthcare becomes so valuable. Regular checkups, recommended screening tests, healthy eating, daily movement, quality sleep, stress management, and avoiding smoking all work together to reduce risk. Growing older is not something to fear. It is an opportunity to become more aware of your body and make choices that support long-term health. While aging cannot be stopped, many of the diseases associated with aging can be delayed, managed, or even prevented from early detection. Healthy lifestyle habits. Every healthy decision you make today is an investment in the years ahead, helping you remain active, independent, and able to enjoy life with the people you love. Heart and blood vessel diseases are among the leading causes of illness and death in adults over the age of 60. But the encouraging news is that many of these conditions can be prevented or managed when they are recognized early. As we grow older, our arteries naturally become less flexible, and years of exposure to factors such as high blood pressure, elevated cholesterol, diabetes, smoking, poor diet, and lack of exercise begin to affect the cardiovascular system. These changes place extra strain on the heart and blood vessels, increasing the risk of serious conditions such as hypertension, coronary artery disease, heart failure, irregular heart rhythms, and stroke. Understanding the warning signs and taking action quickly can save lives and prevent permanent damage. One of the most common conditions after the age of 60 is high blood pressure, often called the silent killer. Like many other diseases, high blood pressure usually develops without causing noticeable symptoms. A person may feel perfectly healthy while their blood pressure slowly damages the arteries, heart, brain, kidneys, and eyes. Because there are often no early warning signs, millions of people live with uncontrolled hypertension without realizing it. Over time, the constant pressure against artery walls causes them to become thicker and less elastic, making it more difficult for blood to flow freely. This increases the workload on the heart and raises the risk of heart attack, stroke, kidney disease, and vision problems. The only reliable way to detect high blood pressure is through regular monitoring. Adults over 60 should have their blood pressure checked routinely, even if they feel well. Heart disease develops when the arteries supplying blood to the heart become narrowed or blocked by fatty deposits known as plaque. This condition, called coronary artery disease, reduces blood flow to the heart muscle. During physical activity or emotional stress, the heart may not receive enough oxygen-rich blood, causing chest discomfort or pain known as angina. Some people describe this sensation as pressure tightness, squeezing, heaviness, or burning in the center of the chest. Others may experience pain spreading to the shoulders, arms, neck, jaw, or back. In older adults, especially women and people with diabetes, symptoms may be less obvious and include unusual fatigue, nausea, dizziness, sweating, or shortness of breath without significant chest pain. These symptoms should never be ignored because they may signal an impending heart attack. A heart attack occurs when blood flow to part of the heart muscle is suddenly blocked. Without oxygen, the affected heart tissue begins to die within minutes. Immediate medical treatment greatly improves survival and reduces long-term damage. Warning signs include persistent chest pain lasting more than a few minutes, discomfort spreading to the arm or jaw, difficulty breathing, cold sweats, nausea, and sudden weakness. Some heart attacks begin gradually with mild discomfort, while others occur suddenly with intense pain. Regardless of the intensity, seeking emergency medical care immediately can make the difference between life and death. Heart failure is another condition that becomes increasingly common with age. Despite its name, heart failure does not mean the heart has completely stopped working. Instead, it means the heart is no longer pumping blood efficiently enough to meet the body's needs. As blood circulation slows, fluid begins to accumulate in the lungs, legs, ankles, and feet. People may notice swelling in their lower limbs, rapid weight gain from fluid retention, shortness of breath during activity or while lying flat, persistent coughing, fatigue, and reduced ability to perform everyday tasks. Many people mistakenly assume these symptoms are simply a normal part of aging, delaying diagnosis and treatment. In reality, early management with medication, dietary changes, and lifestyle modifications can significantly improve quality of life. Irregular heart rhythms, known as arrhythmias, are also more frequent after age 60. One of the most common is atrial fibrillation, a condition in which the upper chambers of the heart beat irregularly and often rapidly. Some people notice palpitations, fluttering sensations, dizziness, weakness, or shortness of breath, while others have no symptoms at all. Although atrial fibrillation may seem harmless, it greatly increases the risk of stroke because blood can pool inside the heart and form clots that travel to the brain. Detecting and treating this condition early can dramatically reduce stroke risk through medications and other therapies. Stroke is one of the most serious complications of cardiovascular disease. It occurs when blood flow to part of the brain is interrupted or when a blood vessel in the brain bursts. Brain cells begin to die within minutes, making rapid treatment absolutely essential. Every adult should know the fast warning signs: face drooping on one side, arm weakness, speech difficulty, and time to call emergency medical services immediately. Other warning signs include sudden numbness, confusion, vision problems, severe headache, dizziness, loss of balance, and difficulty walking. Never wait to see if these symptoms improve on their own because every minute counts in preserving brain function. High cholesterol also plays a major role in cardiovascular disease. Cholesterol itself is necessary for normal body function, but excess low-density lipoprotein or LDL cholesterol contributes to plaque buildup inside the arteries. Over many years, these deposits narrow blood vessels and increase the likelihood of heart attacks and strokes. Since high cholesterol usually causes no symptoms, routine blood testing is essential. A heart-healthy diet rich in fruits, vegetables, whole grains, legumes, nuts, fish, and healthy fats, combined with regular exercise and prescribed medications when necessary, can effectively lower cholesterol levels and reduce cardiovascular risk. The encouraging reality is that many heart and blood vessel diseases are preventable. Regular physical activity strengthens the heart, improves circulation, lowers blood pressure, and helps maintain a healthy weight. Eating a balanced diet low in saturated fats, trans fats, added sugars, and excessive salt supports healthy blood vessels. Avoiding tobacco, limiting alcohol, managing stress, getting enough sleep, controlling diabetes, and attending regular medical checkups all contribute to better cardiovascular health. Paying attention to warning signs and acting quickly when symptoms appear gives older adults the best chance of protecting their hearts and enjoying many more years of active, independent living. As we grow older, protecting the brain becomes just as important as protecting the heart. The brain controls everything we do, from remembering the names of our loved ones and making everyday decisions to maintaining our balance, emotions, and ability to communicate. After the age of 60, natural changes occur in the brain that can slightly slow thinking and memory. Misplacing your glasses occasionally or taking a little longer to remember a name can be a normal part of aging. However, there's an important difference between normal age-related forgetfulness and diseases that affect the brain. Conditions such as Alzheimer's disease, dementia, Parkinson's disease, and depression become more common after the age of 60, and recognizing their early warning signs can make a significant difference in treatment and quality of life. One of the most well-known brain disorders is Alzheimer's disease. It is the most common cause of dementia and gradually destroys memory and thinking abilities. Alzheimer's does not happen overnight. It usually begins with very subtle symptoms that family members may dismiss as simple aging. A person may repeatedly ask the same questions, forget recent conversations, misplace important items, or struggle to remember appointments. Over time, these memory problems become more noticeable. Individuals may have difficulty following conversations, paying bills, preparing familiar meals, or finding the right words during everyday discussions. As the disease progresses, they may become confused about dates, lose track of time, or even forget familiar places they have visited for years. Dementia is not a single disease, but a general term describing a decline in memory reasoning and the ability to perform daily activities. Alzheimer's disease is the most common type, but there are several other forms of dementia as well. People living with dementia often experience changes beyond memory loss. They may struggle with judgment, problem-solving, concentration, and decision-making. A person who once managed household finances with ease may suddenly become confused while paying simple bills. Someone who loved cooking may forget the steps of a favorite recipe. Personality changes can also occur. A calm and patient individual may become easily irritated, anxious, suspicious, or withdrawn from family and friends. These changes can be distressing for both the person affected and their loved ones. Many people mistakenly believe that memory loss is simply an unavoidable part of getting older. While aging can slow recall slightly, severe memory loss that interferes with daily life should never be considered normal. Early evaluation by a healthcare professional is essential because some causes of memory problems, such as vitamin deficiencies, thyroid disorders, medication side effects, or infections can be treated even when Alzheimer's disease is diagnosed. Early treatment and supportive care can help slow progression, manage symptoms, and improve quality of life for both patients and caregivers. Another neurological condition that becomes more common after age 60 is Parkinson's disease. Parkinson's primarily affects movement because it gradually damages brain cells responsible for producing dopamine, a chemical that helps control muscle activity. One of the earliest signs is often a slight tremor in one hand while it is resting. However, not everyone with Parkinson's experiences tremors first. Some people notice that they move more slowly than before, have difficulty getting out of a chair, or take shorter, shuffling steps while walking. Others develop muscle stiffness, reduced facial expressions, softer speech, or problems with balance and coordination. As the disease progresses, simple activities such as buttoning a shirt or writing may become increasingly difficult. Parkinson's disease affects more than just movement. Many people also experience sleep disturbances, constipation, depression, reduced sense of smell, fatigue, and changes in mood years before noticeable movement problems develop. Although there is currently no cure, medications, physical therapy, regular exercise, and speech therapy can significantly improve symptoms and help individuals maintain their independence for many years. Early diagnosis allows treatment to begin before symptoms become more disabling. Depression is another condition that is frequently overlooked in older adults. Many people assume that feeling sad or lonely is simply a normal part of aging, but this is not true. Depression is a medical condition that deserves attention and treatment. Older adults may develop depression after retirement, the loss of a spouse, chronic illness, reduced mobility, or social isolation. Unlike younger individuals, depression in older adults may not always appear as obvious sadness. Instead, it may present as constant fatigue, loss of energy, poor appetite, sleep problems, difficulty concentrating, irritability, or loss of interest in hobbies and social activities. Some people may complain mainly of physical aches and pains without realizing depression is contributing to their symptoms. Untreated depression can affect memory, reduce motivation, weaken the immune system, and even increase the risk of heart disease. Fortunately, depression highly treatable counseling, regular physical activity, social engagement, healthy nutrition, and medications when appropriate can make a remarkable difference. Family members should pay close attention if an older loved one suddenly withdraws from friends, loses interest in favorite activities, or frequently expresses feelings of hopelessness. There are many practical ways to protect brain health after the age of 60. Regular physical exercise improves blood flow to the brain and supports the growth of new brain connections. A healthy diet rich in fruits, vegetables, whole grains, fish, nuts, olive oil, and healthy fats provides nutrients that support brain function. Managing high blood pressure, diabetes, and cholesterol helps protect the tiny blood vessels that nourish brain tissue. Staying mentally active by reading, learning new skills, solving puzzles, playing musical instruments, or learning another language keeps the brain engaged. Maintaining strong social connections is equally important because meaningful conversations and relationships stimulate cognitive function and reduce the risk of depression. Quality sleep also plays a critical role in brain health. During sleep, the brain removes waste products and strengthens memories formed during the day. Chronic sleep deprivation has been linked to poorer memory and an increased risk of cognitive decline. Avoiding smoking, limiting excessive alcohol consumption, managing stress, and attending regular health checkups further support healthy brain aging. The brain is one of the body's most remarkable organs, and although aging brings natural changes, it does not guarantee memory loss or neurological disease. By recognizing early warning signs, seeking medical advice promptly, and adopting healthy daily habits, older adults can preserve cognitive function, maintain independence, and continue enjoying meaningful relationships and fulfilling lives for many years to come. As we age, our bones, joints, and muscles work together to support every movement we make, from getting out of bed in the morning to climbing stairs, carrying groceries, or simply taking a walk. After the age of 60, these parts of the body naturally become weaker due to the aging process. While some stiffness or reduced flexibility may seem normal, persistent pain, loss of strength, difficulty moving should never be ignored. Bone, joint, and muscle diseases are among the most common health problems in older adults, but with early recognition and the right lifestyle habits, many of these conditions can be managed successfully. Understanding the warning signs can help prevent disability, preserve independence, and improve quality of life. One of the most common conditions affecting older adults is osteoarthritis. Unlike rheumatoid arthritis, which is an autoimmune disease, osteoarthritis develops gradually with active cartilage that cushions the ends of bones, wears away over many years. Cartilage acts like a smooth shock absorber inside the joints, allowing bones to move easily against one another. As this cartilage becomes thinner, bones begin to rub together, leading to pain, stiffness, swelling, and reduced movement. The knees, hips, hands, neck, and lower back are the joints most commonly affected because they carry the body's weight or are used repeatedly throughout life. The early symptoms of osteoarthritis often appear slowly. Many people notice stiffness when getting out of bed or after sitting for a long period. The stiffness usually improves after moving around for a few minutes, but may return after prolonged activity. As the condition progresses, pain becomes more frequent and may interfere with walking, climbing stairs, or performing simple household tasks. Some people hear cracking or grinding sounds when moving their joints, while others notice swelling or tenderness around the affected area. These symptoms should not simply be accepted as a normal part of aging because treatment can reduce pain and improve mobility. Regular physical activity is one of the most effective ways to manage osteoarthritis, although movement may seem uncomfortable at first. Gentle exercises strengthen the muscles surrounding the joints, improve flexibility, and reduce stiffness. Walking, swimming, cycling, stretching, and low-impact strength training are excellent choices for older adults. Maintaining a healthy body weight also reduces pressure on weight-bearing joints, especially the knees and hips. Even a small amount of weight loss can significantly reduce joint pain and improve mobility. In some cases, physical therapy, medications, supportive braces, or joint replacement surgery may be recommended to restore function. Another major concern after age 60 is osteoporosis, often called the silent disease. Osteoporosis occurs when bones gradually lose density and become weak, porous, and fragile. Unlike osteoarthritis, osteoporosis usually causes no pain or noticeable symptoms until a fracture occurs. Many people discover they have osteoporosis only after breaking a hip, wrist, or vertebra following a minor fall, or even a simple movement such as bending over or lifting an object. This is why osteoporosis is particularly dangerous. It progresses quietly for years without warning. Several factors increase the risk of osteoporosis, including aging, hormonal changes after menopause, family history, smoking, excessive alcohol consumption, poor nutrition, low physical activity, and long-term use of certain medications. Women are especially vulnerable because bone loss accelerates after menopause due to declining estrogen levels, but men can also develop osteoporosis as they grow older. There are warning signs that may suggest weakening bones. Some individuals gradually lose height over the years due to tiny fractures in the spine. Others develop a stooped posture or experience persistent back pain. However, many people have no symptoms at all until a serious fracture occurs. This is why bone density screening becomes increasingly important after age 60. Particularly for individuals with additional risk factors. Fortunately, osteoporosis can often be prevented or slowed. A diet rich in calcium and vitamin D supports bone health throughout life. Dairy products, leafy green vegetables, fortified foods, fish with edible bones, and appropriate supplements when recommended by a healthcare provider all contribute to stronger bones. Weight-bearing exercises such as walking, dancing, stair climbing, and light resistance training stimulate bones to remain stronger. Avoiding smoking and limiting alcohol also help preserve bone density. Another condition that receives less attention but has a major impact on healthy aging is sarcopenia, the gradual loss of muscle mass and strength. Beginning around the age of 30, adults naturally lose small amounts of muscle each year, but this process accelerates significantly after age 60. Without regular physical activity, muscle loss can become severe enough to interfere with everyday activities. A person may find it difficult to rise from a chair without using their hands, climb stairs, carry shopping bags, or maintain balance while walking. Sarcopenia affects much more than appearance or physical strength. Weak muscles increase the risk of falls, fractures, hospitalizations, and loss of independence. They also slow metabolism, making weight gain more likely and increasing the risk of diabetes and heart disease. Fortunately, muscle tissue responds remarkably well to exercise, even in people in their 70s, 80s, and beyond. Strength training using resistance bands, light weights, or bodyweight exercises stimulates muscle growth and improves balance. Combined with adequate protein intake, these exercises help older adults maintain mobility and continue performing daily tasks independently. Falls are one of the greatest threats to health after age 60 because they often result from a combination of weak muscles, poor balance, vision problems, medications, and fragile bones. A simple fall that might cause only minor bruising in a younger adult can lead to a broken hip or serious head injury in an older person. Hip fractures are especially concerning because they often require surgery, lengthy rehabilitation, and may permanently reduce mobility. Preventing falls should be a priority for every older adult. Regular balance exercises such as Tai Chi, keeping floors free of clutter using supportive footwear, installing grab bars in bathrooms, ensuring adequate lighting, and having vision checked regularly all help reduce fall risk. Chronic pain should never be dismissed as an unavoidable part of aging. Persistent pain often discourages physical activity, leading to further muscle weakness, reduced mobility, weight gain, depression, and social isolation. Addressing pain through proper medical evaluation, exercise, physical therapy, and appropriate treatment allows older adults to remain active and engaged in life. Maintaining healthy bones, joints, and muscles requires consistent daily care rather than occasional effort. Staying physically active, eating a nutritious diet rich in calcium, vitamin D, and protein, maintaining a healthy weight, avoiding tobacco, limiting alcohol, and attending regular medical checkups all work together to preserve strength and mobility. The ability to walk comfortably, maintain balance, lift everyday objects, and remain independent depends greatly on caring for the musculoskeletal system throughout the aging process. Recognizing warning signs early and taking action can help ensure that growing older does not mean giving up an active, fulfilling, and independent life.